Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about benign prostatic hypertrophy. In benign prostatic hyperplasia, or BPH, prostatic refers to the prostate gland. Hyperplasia means an increase in the number of cells, and benign means that these cells aren't malignant. So, they don't invade neighboring tissues. Basically, benign prostatic hyperplasia is the non-cancerous growth of the prostate gland. This condition is common in men for 50 and it's often considered as a normal part of the aging. The prostate is a small gland about the size and shape of the walnut that sits under the bladder and in front of the rectum. The urethra, which is the tube through which the urine leaves the bladder, goes to the prostate before reaching the penis. And that part of the urethra is called the prostatic urethra. The prostate is covered by a capsule of tough connective tissues and small muscles. Beneath these layers, the prostate can be divided into a few zones. The peripheral zone, which is the outermost posterior sections, is the largest of the zone and contains about 70% of the prostate's glandular tissues. Moving inward, the next section is the central zone, which contains about 25% of the glandular tissues as well as the ejaculatory ducts that join with the prostatic urethra. And lastly, the transitional zone, which contains around 5% of the glandular tissues as well as the portions of the prostatic urethra. The transitional zone gets its name because it contains transitional cells, which are also found in the bladder. At the microscopic level, each of the tiny glands that make up the prostate is surrounded by the basement membrane made largely by collagen. Sitting within the basement membrane is a ring of cube-shaped basal cells as well as the new neuroendocrine cells interspersed throughout. Finally, there's an inner ring of the luminal columnar cells which are within the lumen of the center of the gland. Luminal cells secrete substances into the prostatic fluid that makes it slightly alkaline and give nutrients which nourishes the sperm and helps survive in the acidic environment of the vagina. During an ejaculation, sperm leaves the testis, travels through the vas deferens into the ejaculatory ducts. Smooth muscles in the prostate contract and push the prostate fluid into the urethra where it joins the sperm as well as the semen, which is the fluid that comes from the seminal vesicles. The luminal cells also produce prostate-specific antigens, or PSA, which helps to liquefy the gels like semen after ejaculation, thereby freeing the sperm to swim. The basal cells and the luminal cells of the prostates rely on stimulations from the androgens, or male sex hormones, for survival. The androgens include testosterone, which is produced by the testicles, and dihydrotestosterone, which is produced into the prostate itself. This androgen is produced by the prostatic enzymes 5A reductase, which converts testosterone into the more potent dihydrotestosterone. Since androgens are steroids, they can cross the cell membrane and bind into the androgen receptors with the cells of the nucleus. This inhibits the apoptosis, or programmed cell death, allowing luminal and basal cells in the prostate to keep growing and multiplying. Dihydrotestosterone is 10 times more potent than the testosterone because it can bind into androgens receptors much longer. Now, after the age of 30, men produce about 1% less testosterone per year. But for unclear reasons, 5A reductase activity increases with age, so even with the less testosterone can be increased in the dihydrotestosterone. Normal prostate cells respond to the increase in dihydrotestosterone levels by living longer and multiplying, and that's the underlying cause of benign prostatic hypertrophy. This is a normal process of aging, and around 50% of men develop BPH by the age of 60 and over 90% of it by the age of 85. Fortunately, in BPH, there's no increased risk of developing cell mutations that lead to prostate cancer. Rather, the entire prostate gland enlarges pretty uniformly and small hyperplastic nodules conform within it. These nodules are smooth, elastic, and firm and are sometimes mistaken for prostate cancers. Typically, hyperplastic nodules will form the inner portions of the gland, specifically around the prostatic area or urethra called the periurethral zone. When the nodules or the prostate tissues itself compresses, the prostatic urethra, it becomes more difficult for urine to pass through it. So the urine builds up in the bladder, causing it to dilate. In response, the smooth muscle walls of the bladder will contract harder, and this leads to bladder hypertrophy, where the wall thickens and becomes easily irritated. Finally, the stagnation of urine in the bladder also promotes the bacterial growth and can lead to urinary tract infections. Symptoms of BPH start up when the prostatic urethra gets obstructed, and that can lead to weak and inconsistent stream of urine called dribbling. The person might also have to strain when urinating to overcome the obstructions of pain during urination, called dysuria, trouble initiating urination, called hesitancy. Urine builds up in the bladder and it causes a constant sense of incomplete bladder emptying, which increases the frequency of urinations at night, called nocturia. Benign prostatic hyperplasia can be identified with a digital rectal examination, which is where a finger is inserted into the rectum to feel against the interior wall of the rectum, which lies along the posterior of the prostate. An enlarged prostate could indicate benign prostatic hyperplasia, while hard nodules could be a sign of prostate cancer. Levels of a prostate-specific antigens, or PSA, a substance produced by healthy prostate cells, are also elevated in benign prostatic hyperplasia. Since there are more cells around making the PSA, treatment of DPH focuses on relieving the obstruction and allowing the urine to flow normally. This can be done through the medications like finasteride A, 5A reductase inhibitors, which shrinks the prostate gland by inhibiting the conversions of testosterone into dihydrotestosterone. Next, A1 antagonists like phenoxybenjamin can bind to A1 receptors on the smooth muscles in the neck of the bladder, the prostate, and the urethra, causing them to relax and allow urine to pass. In some cases, surgical procedures like transurethral resections of the prostate, or TURP, can be done to remove the part of the prostate. Alright, as a quick recap, benign prostatic hyperplasia, or BPH, is a condition caused by increased 5A reductase activity in the prostate, which leads to increased dihydrotestosterone production in prostate and hyperplasia. This is considered to be a normal part of the aging and doesn't increase the risk of developing prostate in the cancer. The enlarged prostate gland can obstruct the prostatic urethra, which will lead to urine retention, causing the bladder to dilate and hypertrophy. Symptoms of BPH include urinary problems like urinary hesitancy, dysuria, dribbling, filling of the bladder fullness, and nocturia. BPH treatments include medications like 5A reductase inhibitors, A1 antagonists, or TURP procedures.